placing children at the center of both opportunity, advancement, and inclusion spearheaded the reason why the city of Hamilton and some prominent community partners wanted to be involved in the IECSS project. And in this episode of Inclusive Beginnings, we'll take a deeper dive into how all of these parties are interconnected to serve the best interest of some deserving kids. We began our conversation by the group emphasizing one consistent and fundamental perspective as to why they're all involved. All of them are interested in putting the child at the center of everything they do, including their association with this project. So I want to wish all of you a very good morning, and I want to thank all of you for your participation in this latest episode of Inclusive Beginnings, and I'm very delighted to be with all of you to find out just how important this particular project is to all of you and why you're involved. So with that, I'll welcome all of you to the program, and it's a pleasure to see all of you this morning.
Pleasure to be here.
Thank you, Kevin.
Great to be here, Kevin.
Yes, absolutely. I'm thrilled to be here myself, and I'm going to start our conversation just with a general question, allowing all of you to tell me your connection to this project and why it's important to you.
Thank you, Kevin. So it's Alex Majercik. My involvement with the Inclusive Early Childhood Services System study associated with the city's support of the project and my partnership as acting manager of the Special Needs Resourcing and Quality Initiatives. The project has provided extensive knowledge and opportunities to learn in the Hamilton Early Years community.
And so if I could just jump in, I'm Sue Lepore from ASCII, and I just wanted to say that my involvement with this project dates right back to the very beginning. At that time, I was a program manager for an inclusive preschool support program in the city of Hamilton. And so we worked in preschool settings all throughout our community, and we thought it was really important to learn about this study. And because our program was parent driven and had the child at the center of it all, really, we encouraged our families to participate in the project really as a way of having their voices heard about their lived experiences, living and navigating through the system of accessing supports for their child and their family.
Yeah, I can go. Like Sue Lepore, I work for Affiliated Services for Children and Youth. We call it ASCII, and my involvement dates way back to when the project started as well. At that time, I was the Director of Child and Family Services, and I managed the Hamilton Preschool Speech and Language Program, as well as the Central South, which is a regional program, infant hearing, and blind low vision early intervention programs. And with these programs, we touched over 6,000 children and their families annually. And I think what really strikes me looking back is how much the initial findings of the study confirmed how our programs were very central referral sources for many professionals who work with children and their families.
And I'm Karen Paveo. I'm Senior Manager for Children's Services with Community Living Hamilton. And I actually have also been around since the inception of the program. I was at the same program that Sue mentioned many years ago. So that's how I am connected. From there, currently with Community Living Hamilton, our resource consultants, at least on an annual basis, help to recruit families for the project. So they either are speaking to families or they're distributing some of the flyers, either electronically or the paper copies.
I will go next. My name is Shelley Spain and I work for the City of Hamilton. So my connection to the study began in my previous roles, first as a classroom teacher, similar to what Karen was saying, handing out flyers, encouraging families to participate, and then as the supervisor of the City of Hamilton's only directly operated childcare center. So I'm fairly new in my current role as the acting supervisor of special needs resourcing and quality for the early years community in Hamilton. So I'm really looking forward to continuing that connection in this new capacity.
Yeah, and I'm Marion Trent-Kratz. I work alongside all of these wonderful individuals who are really overseeing implementation of services in the city of Hamilton and managing that. So I am Marion Trent-Kratz. I am the Senior Research Advisor for the City of Hamilton's Children and Community Services Division within the Healthy and Safe Communities Department. I was part of the very beginnings of the project during the CIHR planning grant that extended into what now is such a mutually beneficial partnership with the City of Hamilton. And my current role on the project is as a collaborator for the latest iteration of the project. And it was important for capacity building to build knowledge based on children and families, and that would inform policy going forward in the City of Hamilton.
Fabulous. And I believe, Alex, you have the next question, and I'm curious to know, why did your organization decide to be part of this partnership specifically?
Great question, Kevin. The City of Hamilton has an extensive, trusting, and beneficial relationship with the project director, Dr. Underwood, since 2008-2009 on various projects that provided the future opportunity to participate in cross-community-based research partnerships and collaborations to inform local inclusion planning, decisions, and policy. The Inclusive Early Childhood Services System study focuses on community-based knowledge building, and the transfer has had a tremendous impact on how the City of Hamilton and the earlier system of services and professionals understand, plan, and implement inclusive services and programs, as well as develop policy. So from the beginning and across the multiple phases of the project, the elements of that study that retain in Hamilton's partnership commitment are providing Hamilton's families and children and youth with disabilities a voice in the research to share their experiences with services and programs, and alignment and involving knowledge transfer to inform our work on building a high quality, equitable, diverse, and inclusive services system for families and children and youth that addresses barriers and is culturally responsive.
Absolutely. And Sue, the next question goes to you. I'm curious to know, how has your participation in this particular project been influential to you and your organization and community?
Great. Another great question. So thank you. So here currently at ASCII, which is Affiliated Services for Children and Youth in Hamilton, we work really hard to really work with our educators, our early childhood educators and licensed childcare programs here in Hamilton. And so true to our pedagogy and how does learning happen, we rethink and we recommit ourselves to looking at children through a holistic lens, and that we recognize that children really are at the center of all learning. Having a special need is looked upon as a gift versus a deficit. And so at ASCII, our mission in supporting early childhood educators, we help them to create inclusive and diverse learning environments, and that really respond well to the individual capabilities of children. We work on removing barriers, allowing children and families to feel welcomed. We support educators to reflect on their practice and to be intentional in their plan when they're coming up with setting up their learning environments, making sure that it's always developmentally sound. We also encourage inviting parents to participate and to contribute in the child's learning process, and that's for all kids. At ASCII also, we co-lead various communities of practice, and they highlight ways that leaders and educators can come together and talk about ways of supporting inclusion through the development of policy and through community relationships and partnerships and collaboration with all of our colleagues in the city of Hamilton.
Well, I thank you for sharing that information. And Ruth, the next question goes to you. I'm curious to know, from your perspective, what do you view as the strengths of this specific project?
Thanks, Kevin. For me, the study really confirms the difficulties that families have in navigating a system that is so complex in order to get the supports they need. And in terms of my work back as the director, it really reinforced and continues to reinforce the decision we made to situate services such as our universal infant hearing screen in places where families and children frequently visit. So one example is the Early Ons, and they have been a fantastic collaborative partner. Having families come to locations such as the Early On, where we do our universal hearing screen, we feel that we act as a feeder to connect them to the services and the staff there who have a rich knowledge of other services that may be of interest and need to families. I also believe that our involvement in the study has deepened our understanding about inclusive services and the need for clear pathways. It has reinforced how important it is for our staff to know the community and the services available to support appropriate referrals to meet the needs of children and their families. And finally, I just see it as really part of the Hamilton strengths, which is really around partnerships and working together to look at continuous ways to improve services for children and families.
And Ruth, I thank you for that authentic sharing. And now, Shelley, I want to go to you with this next question. And what do you hope to get out of the project, specifically moving forward?
Thank you, Kevin. As we all know, Dr. Underwood is highly regarded and respected, not only here in Ontario, but across the country. So Hamilton as a community, we have learned a tremendous amount from her, and our hope is to continue that partnership and promote her work and the emphasis on inclusion. Hamilton is actually seen as a leader and at the forefront of that work, and we see this as a great opportunity and a great way to strengthen the wonderful work that we do with Community Living Hamilton, with ASCII, and with Ron Joyce Children's Health Center.
And thank you, Shelley. And Marion, the next question is intended for you, and I want to know, how do you hope this project helps to inform policy moving forward from a government decision-making process moving forward?
Yeah, thank you for that question, Kevin. It's really imperative that the project continues to evolve and refine what it means to provide, sustain, and resource an inclusive service system that needs and meets the needs of families and children or youth, especially related to diversity. Hopefully, the project will continue to seek opportunities to engage and leverage policy advocates and allies that it has in the past and going forward that understand how inclusive services systems happen when policies are developed from the voices of families and children or youth to meet the needs of their lived experiences and their unique or intersecting identities, as well as continue to seek opportunities to share knowledge from the project to inform local policy and decision-making at a community level, while also engaging advocacy groups and associations such as the Ontario Municipal Social Services Association or Inclusion Canada, some recent examples, just to continue the conversation towards developing policy. And given the national and international partners' interests related to the Convention on the Rights of the Child and the Convention on the Rights of Disabled Persons and the recent funding of the Canada-wide Early Learning and Childcare, it will be really interesting to see and sit back and see how the project leverages opportunities to inform federal government decision-making moving forward, in addition to the provincial policy.
And Karen, my final question this morning goes to you, and I'm curious to know, how do you think you've defined an inclusive future for all children across the province and throughout this project as well?
Okay, that's a really big question, Kevin. So although I am honored to answer the question, just saying it does make it sound easier than it actually is. I mean, ideally, all children would be seen as innately valuable from the moment they interact with the various systems that they belong to. So that, in fact, the able-bodied really isn't the standard, and that disability is really only visible to keep our resources flowing to those who require them. So barriers would become minimalized compared to maybe what we see now, and we would be removing that difficult navigation that families do have as they move through systems, and that they don't have to choose safety over inclusion. And so, that they're really, our educators out there are feeling confident and empowered to provide those inclusive services. So, and I think, what's most important, we've learned that research matters. And so we need to continue to ask this question, to keep it on top of mind, because a year from now, 2 years from now, there will be a different answer, and that's a good thing. So we need to ensure that our children with disabilities are not forgotten in our discussions and our interactions with various systems.
Well, I really want to take this opportunity to thank all of you for taking some time to share your knowledge, expertise, and passion for this particular and important project. And I want to thank all of you for joining me this morning to engage in conversation. It's most appreciated.
Thank you so
Thank
much,
you.
Kevin.
Thank you.
My
Yeah,
pleasure.
thank you.
Our
Thank
pleasure.
you, Kevin.
Thank you, Kevin.
Yeah, it was wonderful.
In future episodes of Inclusive Beginnings, we'll take a closer look and a deeper dive into the critical role that Indigenous families have played in this project and continue to answer the question, how do we truly define an inclusive future for all children? I'm Kevin McShan, and I'll see you next time.